Good morning, everyone. Myself Gayatri. I'm a nursing lecturer. I'm working in SNS College of Nursing. Today we will discuss about enteric fever. What do you mean by enteric fever? It is one of the important communicable diseases seen in commonly in developing countries. The definition enteric fever is an acute systematic infectious disease caused by the Salmonella typhi and Salmonella paratyphi, transmitted mainly to the infectious. The bacteria caused by Salmonella typhi and Salmonella paratyphi transmission, fecal-oral route and contaminated water and food, flies and cockroaches. Pathophysiology due to the etiological causes leads to contaminated food and water leads to ingestion of Salmonella typhi and paratyphi bacteria enter the intestine leads to enter the bloodstream leads to multiple in liver, spleen and bone marrow leads to the prolonged fever and systemic illness. The symptoms, mainly the incubation period was 10 to 14 days, but can be longer and the onset may be the incident. Symptoms are often non-specific symptoms, the clinically the fever, fatigue, tired, and also the symptomatic, the infectious symptoms can be caused to the patients. The stages, stage 1, it is the slowly rising the temperature for 4 to 5 days, abdominal pain and myalgia, malaise, headache, constipation, relative bradycardia. The end of first week, the raw spots may be appear of the upper abdomen and on the back of the spas and the cough can be occur to the patients. The stage 2, the third week, several become the toxic and anorexia, significant the weight loss, typhoid status, apathy, confusions, and the psychosis. High risk for 5 to 10% of marriage and persuasion may be the cause. That can be lead to the death. The stage 4, it is a recovery period. Slowly, the patient can be recover the illness and also the symptoms can be the recover. Then these are all the symptoms. It is a common symptoms fever like fever, headache, muscle aches, low energy, swollen lymph nodes, and the skin rashes. The diagnostic evaluations mainly history collection and physical examination. Through the history collection, you have to collect the what all the past history, present history, and past medical history, past surgical history. These are all the things you have to collect the history collection and the physical examinations. Under the physical examination, have to collect the head to foot assessment, then blood culture, gold standard best test in the early stage, that's stool culture, useful in the later stage, care to care. What all the bacteria can carry from the stool, the urine culture, sometimes it can be the positive, the viral test, the supportive not conformity, complete blood count can be collect. The management, it could be not the proper management or significant management. The symptomatic management can be provided to the patient. For example, provide the adequate rest and the restrict the activity to help the improve the level of the patient, the medical care, the antibiotics and the corticosteroids to in case of severe typhoid fever, antipyretic and drug. During the drug, you have to maintain the hydration and prevent the dehydration, provide the fluid and electrolyte should be monitored. You have to provide the IV fluid also. It can helpful to the patients and soft digestible diet preferable in the absence of abdominal distensions. The prevention have to provide the vaccination, hygiene and sanitation, travel precaution have to maintain. Thank you.